I'll just look quickly at culturally competent communication. So what does this mean? Okay, so this has to do with valuing and acknowledging diversity when you communicate. Okay, you have to take into cognizance, the diversity, yeah, amongst people, both you as a clinician, the patient relatives, and all of that. To see how you can accommodate the differences in your opinions, differences in how you view things, your view to issues, to concerns, and all of that. Patients might have social issues, they might have emotional issues, might have religious concerns. They could come from various angles, from parental concerns as well. It could be from any angle. And then you as a clinician has a perspective that is more professional, that has to do with the concerns about the health. But of course, everything may not be just about the health. There might be overlapping issues. So how do you accommodate these differences? So it also refers to seeking a common vision, when you have looked at the differences, when you have seen the diversity, how do you find a common ground, between your concerns, the concerns of the patients or the relatives as well. Now, Pedersen developed a model for cultural competence communication, and the model, addressed three very important things: awareness, knowledge, and skills. Awareness, knowledge, and skills. Now, in awareness, it has to do with acknowledging your own attitudes, your biases, and your assumptions. That means that the clinician should be conscious of, what he or her herself, what your own opinions, your own views are. Let's say, for an instance, you have a clinician who is a Muslim. And of course, though you are not trained in medical Islam, so to say, or medical Christianity, so to say, your beliefs as a Christian, your beliefs as a Muslim has an impact on how you think or how you see medicine, okay, or how you want to apply medicine. So it starts with an awareness of yourself, of you, okay, acknowledging your own attitudes, your own biases, your interests, your assumptions, your perspectives to life, and of course to medicine as well. So let's say, as so and so religious person, I do not believe in euthanasia, okay, or I do not believe in homosexual marriage and relationships, or I do not believe in premarital sex and things like that. So it's a good awareness of yourself is the first step to having culturally competent communication, having a good knowledge of where you stand. Now, knowing where you are, you need to also know where others are. So that means that in your mind, when you view things, you should be able to know where others are as well. Okay, what are their beliefs? And cultural here is not just their way of life in terms of maybe traditional cultures and all that. No, their way of life in general: religious, moral, professional, family, everything, social, emotional. So you want to know, how do others see it? Let's say we're talking about sex and you do not believe in premarital sex. Are there other people who believe in it? How do they see it? What do they think about it? Okay, I do not believe in homosexual relationships. How do others see it? Are there people who believe in it? Why do they do so? Okay, and what are their standpoints? Okay, so there are people as well, racial issues. Or maybe I'm not a racist, but are there people who are racist, who castigate others by reason of their skin color, by reason of their heritage, by reason of their origin, and things like that? So you have a good awareness of you, but you want to know about others. Now, knowing all of this, the clinician should have the skill necessary to integrate these two together. Okay, so integrating your standpoint and their standpoint, and their here could be your patient, could be the patient relative, could be an employer who has some concerns about his or her employee. Okay, so your ability to integrate your standpoint and their standpoints, and using that to formulate strategies that can help, teach, communicate, or intervene among these diverse people. So that means that, for me to bring my concerns as a clinician and your concerns, coming to a common ground and for us to move ahead together. So this is basically what the Pedersen's cultural competence model seeks to address. And it's very important that clinicians must have this skill of integrating people from diverse cultural groups. Now, you have also the LEARN protocol, which tries to, put a step-by-step order or model for us to apply the theory you find in Pedersen's cultural model. So the first is for you to listen, listen to the patient's perspective. Now, for you to have a knowledge of where others, where others stand, what their views are, what their interests and concerns are, you must listen to them. Okay, so that means you must be found probing for ideas and concerns of the patients, in terms of what their concerns or what, of course, their interests are in the clinical scenario given to you. Okay, so when you have listened to them and understood where they are coming from, and listening here may be in terms of asking questions to know, okay, open questions, closed-ended questions, but basically you are trying to make them express themselves. Then you explain and share your own perspective. Okay, so I've seen what your interests are, I've seen what you're worried about, I've seen what you're concerned about, I've seen why you have come, and then, but I'm seeing this other aspect as well. As your doctor, I'm a bit concerned. Let's say for an instance, a patient comes and her interest is on contraceptives. Okay, I have seen you are quite concerned about getting contraceptive, maybe emergency contraception. But from my own perspective, because you have been sexually exposed in an unprotected manner, I'm also concerned about what? Concerned about sexually transmitted infection. So you see, the patient did not think of that. So you are explaining and sharing your own perspective. Then we now bring it together. Are there similarities in our concerns? Are there differences in our concerns? Is there something you do not agree with? Is there something I do not agree with, And then you recommend the treatment plan. So based on A, B, and C that we have looked at, okay, I think we should do this. I'm going to give you the contraceptive, okay? I am going to also recommend that you do so and so tests to help us see how you stand on sexually transmitted infection. And I will recommend that maybe you should come back in 3 months' time for us to repeat it, and maybe at 6 months' time as well. And maybe a few other things. I may give you a leaflet on this, and these are the things I think that you will need to do based on my position as, your doctor, or, your clinician. Then after recommending a treatment plan, the doctor is expected to negotiate mutually, to agree together on a treatment plan. So, you should leave it open at the end to say, what do you think about this? Is it all right with you? Are you okay with them? Okay, and the patient says, I'm not very interested in the sexually transmitted infection. Then you can, in a way, try to repeat a bit of the listening part, okay? Is there any reason why you would not? Asking them a question, to understand them again. And of course, if they still do not accept, then you let them be, okay? But a good communication strategy must go through this step. So you find listening to the patient's perspective, your history, your examination, exploring what the problem is, down to negotiating a treatment plan. Now, the ethnic model does similarly the same thing, but of course using different mnemonics. Okay, the LEARN protocol is a bit easy, but let's look at the ethnic model as well. Okay, so you want to use, there are sample questions for you to understand. Now, you need to explain, how do you explain your illness? So you make them explain. That's by using open-ended or closed-ended questions. You want them to explain their standpoint. What is the problem? Okay, and then you guide them. How can you explain this? What about this? What about this? And what about that? So you are trying to help them. You guide them with questions for them to explain why they have concerns A, concerns B, concerns C. Okay, so what else have you tried? Okay, so before you came, they are all in the direction of knowing what the problem is. Okay, what treatment have you tried? Okay, so you want to also know, have you sought any advice from, we say 4 killers here for the sake of this mnemonic, but of course from any healthcare provider, it must not be folk. Okay, could it be 4 killers? Could it be maybe you have been to the GP surgery and before coming to this specialist clinic or this specialist department? Or of course, what else have you done? Okay, so you want to find out all about that, and then you negotiate mutually acceptable options. Okay, so that means that at this point of negotiation, you bring in your own interests, your own concerns, your own professional standpoints, and then you try to marry all of them together. And then at the end of that, you agree on the intervention. That means you summarize what you have agreed on. Okay, so we've agreed on A, B, C, and D. And then, you mention, of course, you take a look at collaborations, possible collaborations that may help in implementing what has been agreed on. Okay, so are there things that the patient needs to do? Are there areas where the family can come in to support? Are there things the family can do at this point, maybe to help, to implement the interventions we have agreed on? And others. Do we need other people, maybe other healers, like, maybe specialist care? Let's say you're in GP surgery and then you need somebody higher. Okay, you need a specialist, you need to send to the hospital. All of those are collaborations that can help to implement the interventions we have agreed on. So this gives an overview of what we call culturally competent and compatible communication. And every clinician must be found, to be very skilled in executing this. Thank you very much.